So hi everyone, this is the first episode of MDcast, and today we have uh, Dr. Weiner of Texas Medical Center with us. Um, so for the first question of the day, what made you decide to go into surgery?
Well, first of all, thank you for inviting me. Um, I'm here in Houston, Texas, and have a little break from my schedule, so I'm happy to chat with you. Um, so, what made me go into surgery? I think that well, I'm specifically in neurosurgery, and even more specifically, pediatric neurosurgery. So, interested probably in college. I was interested in the brain. I took an introductory psychology class, and my professor was outstanding, and he wrote the textbook that we used and was a very entertaining and engaging lecturer. And he taught about the brain, and I became very fascinated and got more interested over time and decided to major in the biological base of behavior, which is neuroscience essentially. And um, after a while, I decided, well, maybe I'm most suited to be a doctor just because I like people. And then I started sort of shadowing different doctors and had an interest in surgery because I like the concept of working with my hands and being creative. And also the idea of fixing a problem, having a problem and fixing it. So surgery appealed to me. And so I exposed myself to a number of different surgical specialties, orthopedic surgery, and then neurosurgery. And I spent a lot of time with some of the neurosurgeons at Cornell Medical Center. And I was hooked and decided that's what I wanted to do, even though what I was interested in then and what I do now are completely different. But it was sort of a process. And I think the huge influence for me were people. So if you have mentors or people along the way that inspire you and give you a vision of what you would like to be like or do or accomplish, I think that that's extremely helpful in terms of creating a vision of what your career could be like. So yeah, but to do surgery, you have to love doing surgery. You have to love being in the operating room, and um, it's it's definitely stressful. You have children's or patients' lives in your hands, and you have to treat that with when I get ready for an operation, it's like training for a marathon. You have to be in your top form and be ready to go. So
Yeah, I had a quick question. You mentioned that you love like like dealing with people, and but you're also like a pediatric surgeon or neurosurgeon. So what's it like treating like peds, like children, and it's not really like an adult that you can explain the complex surgeries and whatnot.
yeah, so it's a great question. What's the difference? I think in pediatrics, you're treating a child obviously as a patient, but you're also treating the parents and the family. So I kind of joke that um, even though I'm a surgeon, my role is 90% like being a rabbi. I have to really show and demonstrate that hope and optimism that we can get this child through sometimes a very crisis laden situation, and instill in the parents a sense of comfort, confidence, optimism. um, Explain things in a way that is down to earth, kind, um, normal, not using scientific jargon. In the end, people are people, and they appreciate it if you treat them in a human way. So even with that, children are amazing patients. They're much more resilient than adults. They're honest. They want to be treated with honesty. If something really bothers them, they'll tell you. But they're much more resilient. They're stronger. They're tougher. Um, they don't complain as much. They can handle a lot more, and they have a lot of what we call plasticity. So their ability to recover is much greater and more rapid than myself or older adults. where our physiology and our bodies necessarily, not necessarily can recover in a way that kids can. Certainly that's true of the brain. So we can do a lot more in a young developing brain than we can in an adult brain. And that's often the rationale for why we do what we do. A lot of the procedures that we do are based on the idea that a child is a developing brain and a moving target. And so the stakes are much higher. The clock is ticking, so to speak. But we're treating a child and we're also treating a family. So that's really exciting. And I'm still in touch with my patients from 23 years ago who are in college or out of college, who are parents themselves now. And that's one of the great joys of the job is sort of seeing all the different lives that you connect with over time. And it's extremely gratifying.
So going back to that idea of plasticity, is there anything that in the operating room you would be able to do on a pediatric patient rather than an older patient? Or is there anything that's vice versa that you wouldn't be able to do on a pediatric patient that you would do on an older patient?
Well, I think that in terms of neurosurgery, we may have a little more leeway, meaning that kids can recover from certain procedures in the brain in a way that adults may not be able to. Their brain function can actually move around and rewire itself in a way that adult brains cannot. So that's one way that we can do more in a pediatric brain. The flip side is a child, particularly a young child, is very small. So today I performed a procedure with my plastic surgery colleagues on a tiny little baby, a few months old. And if you lose a drop of blood in a child that young, it's significant, and it has implications for healing and anesthesia, et cetera. Whereas in an adult, they're bigger, they're hardier, they have a greater blood volume, and you have a little more leeway to, if you lose blood during an operation. So that's sort of the downside of treating kids, is they're physiologically very tiny and you have to be very careful.
So going off this idea about how you have to be so careful, how do you deal with making an error during surgery?
It's a great question. The hope is that there are no errors. That's the goal. The mantra is it's got to be perfect. And, we're human beings and therefore we're not perfect. But the expectation is that everything will be perfect each time, which is why I feel like preparation is so important. Obviously, at this stage, I'm sort of, I don't know, I'm 57 years old, so I'm sort of, I don't know, mid-career. I don't know what you would say, but I have a few more years left. But I would say if you do something a lot, like anything, you do it better. So repetitions, that's the whole rationale for a resident training program. So after college, you have 4 years of medical school. Residencies vary in duration. Mine was 7 years plus a year of fellowship in pediatric neurosurgery. And then you go out into practice. And the idea is you do something over and over and over. So, you first watch during residency, then you do it under supervision, and then you do it on your own. And there's a great way for training, gaining confidence and skills. And the more you do of something, the more you can hone your skills and get better. I think that the idea behind surgery is coming in with a completely mentally rehearsed and prepared procedure where you have your A team, you have, your surgical tech staff, your operating room staff, your anesthesiologist, your residents and fellows that are going to be working with you, and everybody needs to be 100% prepared. And fortunately, we don't have errors, the vast majority of the time. There are many systems in place to prevent errors. So one of the most obvious and egregious is, operating on the wrong side of the body. And so a very simple way to prevent that is, years ago, the technique that was instituted to sign the patient's part of the body that's going to be operated on, so you don't do orthopedic surgery on the wrong knee or shoulder, or on the wrong eye, or on the wrong side of the brain. And then we have checklists that you would use in other industries, like flying an airplane, where you have checklists before you do something. We have what's called a timeout, where we stop and we talk about, in a very systematic way, in a uniform way, about what we're planning to do and what we need to be prepared for. And so all these things are utilized because humans are not perfect and we're not robots. We do use surgical robots, but in the end, surgery and medicine require the human touch, human judgment, human interactions, and we try to make it as perfect as possible. If there is something bad that happens during or after or before an operation, that's where the humanity comes in, and how to sort of deal with it, communicate that in an honest way, and deal with the fallout. So there's definitely a way to do that and a way not to do that.
Yeah. I have a question about, is there any chance you can give us some insight about the emotional like roller coaster of like either going through a surgery and being successful and like pumping your fists, or maybe not so successful, and like what are the emotions like, and like how do you cope with it? And then I had one more question, was do you have any like rituals when you get into the operating room? Like, do you meditate? Is there like do you have like a chant? I was just curious if there was anything.
Really good questions. I think that, yes, there's a tremendous amount of emotional, physical, emotional, stress or use before, during, and after surgery, or even taking care of patients. So, when you come in, you're 100% giving to the patient and to the family. So you obviously have to recharge your battery. I think that patients know when the doctor is a balanced human being and has balance in their life. So, as I've gotten older, it becomes very apparent to me to have strong foundations outside the hospital and in the hospital. I think it's key to work with a team and with people whom you respect and trust, who are honest, who have integrity, and you enjoy working with, who are fun to work with. And that's a huge part of building a team, and then giving them a vision, and leading by example. And then outside the hospital, obviously everybody has their own situation, but for me, it's my wife, my kids, my friends, my family. I try to stay very balanced so I can deal with the emotional roller coaster of being a doctor. I think that having routines like exercise, having a good diet, having a life outside of work. Some of the tragic things I've seen are senior people in my field who, when they finish, they have nothing else going on. And I think that's becoming more of a rarity now, but they struggle during retirement. So I think that you come into a stressful emotional roller coaster if you're balanced and you have a good support staff. So like I said, exercise. In terms of rituals, I pray in the morning. It's part of my daily routine of being Jewish. So that's a time when I, really get my head together and have some quiet time away from my phone and from people. I think that's essential. People do all kinds of things. Before I start an operation, I usually stand by a window and I pause and I think about, how I want it to go. And it's sort of like a little meditation. But I think a lot of surgeons are OCD or ritualistic. So, I have a definite routine of how I park my car, how I walk into the hospital, what I bring with me, the coffee I drink, what I wear, how I scrub my hands, the music I listen to. I'm very musical. I listen to music all the time. So that helps my brain work. So all these things are ritualistic and somewhat why come in less balanced. That's just my perspective.
I had a question. Is possible for people like us to get into medicine?
Mhm.
I think a big concern of that a lot of us have is that, so after all those years, do you feel like you kind of got a late start? And obviously those are all very necessary things necessary to become a surgeon, but did you ever feel like, you were getting into it kind of late at any point?
It's a great question. I think that like most things, all during residency, I was earning a paycheck, and I was married for a good part of my residency, and somehow we managed. So, like I told my son, who's a senior in college now, who's going into computer science, like don't be upset if you don't, have that dream job right out of the gate, because it took me 12 years before I had a real job. So I think it sort of goes a little bit against a lot of the mentality now, which is like everything fast, fast, fast. Nobody has patience for anything anymore. But I think that it's a process where you'll grow, and you'll come out really well prepared and ready. I think most people who graduate from medical school and residency have great jobs, and there'll be an increasing need for us, and increasing need for good people. So I think it's just a process. So you have to sort of commit to that process, but it's definitely well worth it. So to answer your question, I don't feel like I've missed that. I don't feel like I got to it late in the game. I feel like I kind of rushed through. I was one of the people who didn't take any time off.
So during this time, how did you deal with seeing like other friends or people your age being able to go out and like have more free time rather than a medical student or a resident who's always working very hard all around the clock?
Great question. I think that the key is having, there are going to be periods of time, much like your experience in college now, I would imagine, where it varies. Like, so you have some periods where it's brutally hard and you're just, in survival mode, and like during finals where your every hour is scheduled and you have no time. And then you have other times where it's very light, and sort of the whole experience over those 12 years or 16 years was sort of like that. I think that I had a year and a half of research. After my training, we lived in Paris for 6 months and had fun, and I was doing research over there. And I think that, like I said, it relates to what we talked about before. I think having balance, being generous, investing in your friendships, and I was surrounded by people who understood what I was doing, respected me. I kept all my friends from my early childhood, and made time to see them. And then of course I met a woman who I'm now married to, who is very smart and very caring, and has been extremely supportive. So we sort of support each other, and that's been helpful. So I think yeah, it definitely requires effort. It doesn't happen by itself. But even now, I feel, because of the pressures of work and life, I don't have a chance to necessarily see my friends as frequently as I would like to. Certainly during the week, I don't. But that's, I try to catch up on the weekends, and, that's sort of my social time. So yeah, I think it requires effort, but it's definitely doable. I mean, I think I try to, one of the things that's really super important to me is family, friends, and I never compromised on that. I basically chose residency and chose positions sort of so I could preserve what I wanted to do with my life. I wanted to live in New York City, so I went to medical school in New York City, did my residency there, my fellowship, and worked there for another 20 years. So until I moved to Houston 5 years ago, that's where I wanted to be. So, I think, work with the principles that have worked for you up until now.
Yeah. I just had one final question. I was
Yeah.
curious about the type of surgeries you do. And I know you're doing pediatric neurosurgery, but is it ever repetitive, or are you finding something new to do? Like, do you continue to find it interesting, or does it get boring? I mean, I can't imagine it gets boring at surgery, but
It's a really
I just,
great question. It's a really, really good question. I think it's a balance. So I came here to Houston to work at Texas Children's Hospital, which is the biggest and probably the best children's hospital in the country. That's my opinion. That's why I came here from New York. And we see in our group, we now have 6 faculty pediatric neurosurgeons. We see sort of lots of everything, but we tend to have each one of us focus in an area that we love, we each individually love, and we each try to sort of change the field and innovate in. So even though we sort of do all the basic things that come in, and there are a set of basic things that we deal with, certain congenital problems or tumors or trauma that we all sort of deal with. And then on top of that, which you might call repetitive, where we're doing a lot of, and everyone's sort of doing it, we have more specialized areas where we're trying to drive the field forward and change the way people think about it, and change the technology, and combine both, not just the way you think about it, but also the way you actually carry it out technologically. So, so it's a combination of both, and that's what makes it so much fun. But you definitely have that repetition and that sort of regularity, and that's what makes some days a little less stressful, even though there's no small operation, as we say. The only small operation is the operation that someone else is having. It's not, everything's a huge deal, and it's got to be perfect. So I think that, it's a mix, but being in a place like this where, the institution and the hospital leadership supports, driving the field forward and leaving neurosurgery better than you found it. That's what makes it so exciting for the patients and for us.
I have one more thing actually, now that you said that. You talked about like improving certain areas of the field. Does that mean that a big part of your job, or like, I guess, what percentage of your job is research and trying to improve certain areas?
It's great. It's a really great question. I think that technically I'm at what's called an academic medical center, meaning we're part of a medical school. So I'm part of Baylor College of Medicine, which is one of the very best medical schools in the country here in Houston. And the idea is that, we're yes, our mission is to take care of patients, but we have 2 other missions, and one is to advance knowledge in the field through research, and that research can be basic science research in a laboratory, or clinical research, looking at big data and doing collaborative studies on patient data. And we do both here in our group and at large. So, and then the last is teaching, and teaching the next generation. So we have a very active residency program, fellowship program, and then we also have medical students and college students that come and spend time with us. So, that 3-part mission is tried and true of, clinical care, research, and education. So for me, research is, a smaller percentage of my overall time, but it's definitely a significant part, because we, like I said, we don't want to just have the same old. I mean, we see now with the COVID pandemic how quickly knowledge is advancing and how quickly treatment is advancing, and that should be the model for all fields of medicine and healthcare. So, some people, some physicians spend, the majority of their time doing research and only see patients rarely. So I think people gravitate towards what they enjoy most. There are physicians in private practice who don't do research, and they're just interested in being the best clinicians they can be. And we all see those kind of doctors, and healthcare is largely made up of people who are not in academic centers. So I think that there's a wide range, and I think the key, like in a lot of things, is to expose yourself to all the options, see what feels right, what really inspires you and excites you, and know that the sky's the limit. Like, don't ever accept limitations. Like, think big. If you have a mentor or someone who inspires you and you view as a role model, then definitely connect with them. And that's been a huge part for me. And I think that's something that will, lead you to, achieve all your goals in medicine.
Amazing. All right. Thank you so much, Dr. Weiner, for your time.
Sure.
We all learned a ton from this.
Sure.
And I will definitely send you out the link or any information once we put that out there, so you can rewatch this or send it out. But we
Wonderful.
really appreciate it. Thank you so much.
Oh, it's my pleasure. You guys are awesome.
Thank you.
Okay.
Thank you, doctor.
Have
Bye.
a great rest of your day.
Bye.